Yeah, when the valve disease progresses to a stage where the patient is severely symptomatic and is unable to carry out his or her normal activities of daily living without any symptoms, and that is the time when we make an assessment and decide if the patient requires something more than medicines. So unfortunately, in the natural progression of most patients of valve disease, this stage will come one day or the other. And when this happens, the only definitive treatment for these individuals is to replace the diseased valve. That is called a valve replacement surgery. In the case of the aortic valve, that is the main valve that connects the heart to the aorta. It is called aortic valve replacement. Conventionally, this aortic valve replacement is done by means of an open heart surgery. It's called a surgical aortic valve replacement. That has been the standard treatment for aortic valve disease. That has been there for several decades, and it's a relatively safe and effective surgery, and patients usually go home in about 5 or 6 days. It is also possible to do this surgery with a small cut, which is called a minimally invasive aortic valve replacement, and the results are usually excellent. But there are some individuals, some patients who are too old or are too frail, or they have other problems with their lungs or their kidneys or with their brain, which makes them not suitable candidates for undergoing an open heart surgery. In these individuals, there is an alternative method of replacing their aortic valve that is called a transcatheter aortic valve replacement. Transcatheter aortic valve replacement means that we can replace or implant a new artificial aortic valve in a patient with severe aortic valve disease without the requirement of an open heart surgery. This is done just the way we do an angiogram or an angioplasty. Through the artery in the groin, we pass a small tube, and through the tube we pass the valve and implant it in the position that is required with the help of X-ray.